Good day everyone. Today me and my team 3 are going to present a topic, medical error disclosures, accountability in patient care. So, the case revolves around Dr. James, a senior surgeon who faces a dilemma after a minor mistake by a junior resident during a routine surgery. The error led to an infection in the patient, Mr. Thompson, resulting in an extended hospital stay and increased costs. The focus of this presentation is to explore accountability and decision making in medical error disclosure and the implications these decisions have on patients, trainees, and the hospital.
So the key players in our case scenario are Dr. James, he is the senior surgeon, junior resident, and Mr. Thompson, the patient. So basically this scenario is happening in a teaching hospital where Dr. James, being a senior surgeon, is doing an operation which is called appendectomy, and the junior resident is assisting the surgery with the Dr. James. And during the surgical procedure, the junior resident didn't maintain the sterilization of the surgical instrument, and he basically continued using the same disinfected instrument on the patient, which ultimately led to the infection of Mr. Thompson's. So now that Dr. James is facing a very critical situation, he's thinking that should he take the responsibility for the error which was made by the junior resident, or let the junior resident admit the mistake, potentially jeopardizing the future career of the junior doctor. Meanwhile, the hospital legal team advises against full disclosure to the relatives due to the risk of a lawsuit, even though ethical guidelines suggest transparency with the patient. So this situation highlights common challenges which are happening in the teaching hospitals where accountability and training intersect. So our case scenario has emerged with 3 key problems. Number 1 is transparency versus protection. Number 2 is managing accountability, and number 3 is legal and ethical considerations. So as far as the first problem is concerned, there is the ethical dilemma of whether Dr. James should prioritize transparency with the patient, Mr. Thompson, whether he should tell him all the things which happened during the surgery and the mistake which was done by the junior resident, or should he protect the junior resident's career. So he's really confusing between these 2 things. And the second thing is, how should accountability be managed in the teaching hospitals where such errors occur on daily basis, and due to the involvements of the junior residents or trainings, because definitely they are not that much trained and they are learning from their seniors, but they can do mistakes. So how the teaching hospitals can manage these type of things. And teaching hospitals face unique challenges in balancing the patient care quality with the learning needs of the staff. And the third one is that legal and ethical consideration. Additionally, there are both legal and ethical implications to consider. Reporting the error to both the hospital administration and the patient could result in litigation, yet ethical guidelines emphasize honesty and transparency in patient care. To guide our analysis, we need to address the critical questions. The critical question is that, should Dr. James take the full responsibility for the mistake done by the junior resident, or should he involve the resident in the disclosure process? How can the hospital balance the need for training with patient safety and ethical care?
In examining this case, we need to consider the ethical implications. According to the professional guidelines, honesty and transparency with the patients are the core values in healthcare ethics, as described by Emanuel and Emanuel in 2012. Failing to disclose these errors could undermine the trust between patients and the healthcare provider. This situation prompts us to consider how policies within the teaching hospital can balance transparency with educational objectives, ensuring the trainees to learn accountability while safeguarding trust and safety within the healthcare system. legal considerations include hospital legal teams, risk mitigation, and professional liability. When talking about hospital legal teams, which often advise us against full disclosure of any incident. Risk mitigation leads to limited disclosure, which will protect the hospital staff from litigation. Professional liability leads to medical errors, which results in lawsuits against doctors and hospitals. Furthermore, accountability in teaching hospitals adds another layer of complexity to the healthcare system. Errors are inevitable, part of the learning process, and it is crucial to create an environment where the trainees can learn from mistakes without fear and have a good career in the future.
So Dr. Thompson is on a crossroads. Like, he has two critical decision points. One is going through the full disclosure for the error, and second one is following the legal advice. Choosing full disclosure upholds ethical standards and honesty, but it might risk junior residents' career and hospitals and opens hospital for potential litigation. Conversely, following the legal team's advice, it might protect the resident and the hospital, but it could compromise patients' trust and ethical integrity of the healthcare professionals. Following on to the possible solutions, our team came up with 3 different options that Dr. James can follow through. Option 1 is Dr. James take full responsibility by explaining the situation to the patient. Option 2 involves Dr. James and the resident sharing the responsibility of the error and ensuring the transparency. And option 3 is following the legal advice, which will minimize disclosure but offering the patient necessary care. So with option 1, Mr. Thompson, while simultaneously supporting the residents' learning and growth, it demonstrates ethical integrity and accountability. With second option, this could help maintain the patient's trust while showing that mistakes are part of education process. While the option 3, which is following the legal team of the hospital, it will minimize the disclosure. However, this might harm the patient-doctor relation and the trust on the long run, and could seen as a compromising ethical standards in healthcare.
In conclusion, accountability in healthcare requires a careful balance of ethical obligations, legal considerations, and the education lead of teaching hospitals. Dr. James' decision will have significant implications for patient trust, the residents' future, and the hospital's policies. We must consider how teaching hospitals can create an environment that supports both transparency and trainee developments. Establishing clear policies and ethical guidelines can help navigate these challenging situations. Now I'd like to put an open question to the forum. How can teaching hospitals create an environment that supports both transparency and the development of the trainees? Thank you.